Dr. Doyin now, when you look at this issue of public health, how serious can we be? Let's leave government out of this now. As Nigerians, how serious can we be about it? How serious do we need to be about it to ensure that we don't have an epidemic on our hands?
But I'm happy you said leave government out, because I think what Ebola is bringing to board is the fact that this is collective responsibility. And that if people did what they were meant to do, really, most diseases and things will be well taken care of. In most instances, like now, we keep talking about hand washing, for instance, and people are practicing that as a ritual, and it's not a ritual in itself. And I always like to explain to people that this is what we should have been doing all along. We do it all the time. Somebody comes in with a cold, we don't want to shake him. But if we do, we want to wash our hands. I said we should have been doing that all along. So Ebola is only re-emphasizing, the personal hygiene, the collective responsibility about behaving right, about cooperating with the authorities, about being your brother's keeper. It's all those same things we've always known.
Perhaps it will boil down to the fact that some people, this issue has really not, been so much taken in by them. Because if you know that if you have had contact with an Ebola person, and then you know that you're going to transfer it to another person, or you can also die from it, why would you want to live, where you're being under surveillance and being watched to see that you don't have the virus? Do you think Nigerians are really taking in this message?
Well, I think there are a few things to think about there. One is the message we passed across, when Patrick Sawyer came. We spread panic. First we started telling everybody it's a death sentence. So people also thought, maybe I have no choice here. Go to the health authorities, I get locked up till I die. Otherwise, let me try to help myself. That's one. The second one is the stigma, which is that it looked like you're a dead package, and nobody should deal with you in that sense. We should see it as another disease, which in fact could be well taken care of, as Nigeria's case has shown clearly, with good examples, people who survived. And in fact, the good thing about the survival is that the virus actually gets eliminated, which again tells you there's no reason for this strong stigma, as it were. So it's about caution, but not stigma. The fact that I avoid contact is caution, not that I see you as a bad person or something like that. So I think that's what it's pointing out to us. And also it speaks about distrust to some extent, that we don't seem to trust the health authorities, which we should, because again, they work